My name is Jihed Sioud. I am a doctor of pharmacy, graduated from University of Monastir, Tunisia. And I did my master's in artificial intelligence for health and biomedical research at the University of Grenoble Alpes, France. Today we will be having a short introduction to AI and its implication in the pharmaceutical field. I'm sure you will be a bit interested in that. Also, I wanted, before I start, to thank all of you for inviting me. Special thanks to Mr. Philip and also all of the team organizing this meeting. Myself, I've been an IPSFer a long time ago, so it's an honor to be with you. So, should we start? I'll be sharing my screen now. So, it's all right, visible?
Yes, great.
Yes.
Okay. So today, as I said, we will be talking about artificial intelligence and its implication in the future of the pharmaceutical field. We will having two parts. The first one will be some basic concepts in artificial intelligence, so you would know what we are talking about. And the second part is will be a bit of applications. I will give some examples and the implication in the pharmaceutical field. So the first question that we should be asking, what's artificial intelligence? Artificial intelligence is the use of automated algorithms to perform tasks that are traditionally relying on human intelligence. So the thing is, in the medical and pharmaceutical field, AI is starting to be used a lot more, especially these days. There is a big hype about AI. But a few years now, AI was used for drug discovery, for clinical trials, for personalized medicine, for drug safety, and it has the potential to enhance the efficiency and quality of the pharmaceutical research practices. And this is a new area, so the possibilities are expanding from day to day. So before we talk about artificial intelligence, let's define a bit what is intelligence. Intelligence is the ability to perceive or infer information and retain it as knowledge to be applied toward an adaptive behavior within an environment context. So the important parts are the adaptive behavior and reacting to the environment or context. We are talking about general intelligence. So the artificial intelligence, apart from the fact it's the intelligent systems, it's a whole discipline, is the field of study of intelligent agents, with which refers to any system that perceives its environment and take actions to maximize a chance of achieving a certain goal. Okay. Now we start with the first part, as I told you, the basic concepts in artificial intelligence. So generally speaking, artificial intelligence is a broad term which qualifies for a general notion. It's any system that learns from its environment. Either it's a reactive or non-reactive system. It's qualified as artificial intelligence as long as it reacts to the environment. So what is more interesting to us as pharmacists, scientists, and researchers is the field of machine learning. So machine learning is a subtype of artificial intelligence. It's basically mathematical models that are able to learn directly from data and not programmed specifically for specific task, but it could learn without the forward problem being explicitly defined, okay? And within the concept of machine learning, we have another subtype, which is deep learning. Deep learning is a bit more complex, but is the most used because it gives the impression of most intelligence, let's say. Okay, so deep learning is a specific type of artificial intelligence. Basically, it's based usually on artificial neural networks. We will talk about that later. And they are a lot more complex than general machine learning, okay? In the recent years, and as we advance in artificial intelligence, there is a bit of distinction that is being made. So the broad term that was used as artificial intelligence is now dissociating itself from machine learning. Nowadays, in a technical field, we call artificial intelligence the reactive intelligence systems. So any agent interacting with the environment and taking actions like self-driving cars, robotics, and other stuff, it's called artificial intelligence. And learning based on passive observation, which interests us the most, is the machine learning, okay? So about machine learning. Machine learning is not, there is a big misconception about artificial intelligence in general and machine learning. It's always associated with computer science. What I believe is that machine learning is more associated with mathematics more than computer science. And also machine learning takes from really various fields. For example, in machine learning, we use a lot of types of regressions, which come from statistics, regularization, which involves problem solving in mathematics. We use also numerical analysis. In the learning process, we use a lot of computational differentiation and derivative calculations. Also, it relies on signal processing, like image and video processing or such things, and even information theory like entropy and stability and such. Okay, so there is another distinction. Traditionally, we use some kind of statistical tools in the medical research or such. And there is a bit of similarity between machine learning and statistics, okay? So I'm giving a bit of an example. In traditional statistics, let's say we have a data set containing the survival rate of glioma patients, okay? With a statistical approach, we have our data. We will try to estimate the impact of the patient age, for example, and the survival rates, okay? Statistics will give us facts, approximations, okay? When we are doing trying to make a machine learning model based on the same data set, we will have a different goal. Instead of trying to make facts, we will try to make predictions. So when we train our model on the same data set using machine learning tools, we will be able to predict outcomes for new patients that are not registered in the training data. Okay, so machine learning is able to do predictions which statistics do not. This distinction apart. Now we will be talking about the general types of machine learning algorithms. In fact, there are the main three types of machine learning are the supervised, unsupervised, and the reinforcement learning. The difference between supervised and unsupervised. For the supervised learning, you have your data. Let's say you got any data about patients, about anything actually, and this data is labeled. What means label? So there is a human expert who labels the data. You know the results and you know the details. For example, we have a simple this simple example, which is the apple. So you have a list of a lot of images from various things, and they are labeled. This is an apple, this is a dog, this is a cat, and a human expert labels the data. Okay. If you make a machine learning algorithm in a supervised fashion, so the algorithm will train on this labeled data, and finally it will be able to recognize the object. Okay, so your goal is to let the algorithm say this object is an apple. In contrast, for unsupervised learning, you have a lot of data which has no labels. The algorithm have no way to know what these objects are called. Okay, so your algorithm will be trying to learn underlying structure from the data and try to cluster it. So like in this example, it will be able to say that the first and the second object are similar to each other and may be the same type of object. Okay, and the last part is a bit less used, but really important. It's the algorithms that can associate state and action. So, for example, you have a lot of data about different things, and finally, the algorithm will try to make conclusions like eat this object to stay healthy. So, for machine learning in general, there are other types, but these are the main pillars for simple machine learning. Okay. So let's dive in a little bit deeper. For the supervised learning, we have, as we said, the labeled data. So your algorithm generally will be able to do classification and regression. Classification is when you have this data, which is labeled and with categorical values. Like we said, this is an apple, this is a dog, this is a cat. It's called categorical values. So your algorithm will be able to create groups to do a classification. But sometimes you have numerical values. So you have different readings from different patients, and you have the value you are looking for. Let's say you want to predict the glycemic level for a patient based on other readings. So it's a numerical value, it's a continuous value. Your algorithm also from the other readings should be able to predict with a certain accuracy what are the glycemic value for the patients with these reading. And as we said previously, it's like always about prediction. Okay. So for the unsupervised learning, as we said, you will be starting with data with no labels. So the algorithm have no way to recognize to recognize the outcome, but it will try to find underlying structure in the data and the results. So the main two specialties, let's say, of unsupervised algorithm is to cluster the data. Here there is an error. It's a clustering, not classification. So to try to find clusters in data with underlying structure. Okay, so it may be able to find similarities in groups of data that would otherwise be invisible to a human analysis. Okay, and the other thing that AI can do for such data, it's what we call dimensional reduction. So you have a lot of data. Let's take this example. You have, let's say, genomic data with a lot of samples and a lot of genes, a lot of data, which will be really difficult to deal with using traditional methods, statistical methods, and such. So what AI can do, it could find a new representation. You will see representation learning later on. A new representation that could be a lot easier to understand and that would be more explainable. Because the problem with AI almost is that the process cannot be explained in, let's say, human terms. And explainability is really, really important in the medical field. So AI can help with the explainability of huge data with dimensionality reduction. Okay. So there is another really important aspect, which is when we are trying to predict results from medical data. There is a concept which is called generalization. So you have your data set, which contains information. You make an algorithm to make something of it, to be able to do predictions. So when your algorithm is working, it will try to map a function of the distribution of the data. So let's say, like we see here, there is a function mapped here of the data. It's an approximation. And your algorithm, when confronted with new unseen data, it will be able to apply such a function and predict the outcome. But depending on the training of the data, which we call learning, sometimes we have what we call underfitting. Is that your map function does not really reflect the distribution of data. It may be due to lack of learning, to maybe due to other problems. And it would be not representative and would not be able to predict new unseen data. And the fact to predicting unseen data is what we call generalization. And there is another problem, is when you follow strictly the data that you have in your training set. You're training your algorithm, and you have a lot of data to train on, and you don't let the noise in. What we call noise, it's the disparity of data compared to the mapping function, okay? So you will follow really strictly the data that you have, so your algorithm would not be able to really generalize a new unseen data, okay? So it will be really bad because your main goal is to do accurate prediction. And accurate prediction should be reflecting also new unseen data, okay? So when we train an algorithm, generally there is a learning pipeline, which is we split the data in training and test data sets. You get your information in the training data sets, and you will let your algorithm try to work on it, to learn from it, and to map a predictive function. So afterward, you will enter new unseen data, which is the test data set. and evaluate how your model is performing. Is it really generalizing or not? So you could tweak it and change the AI parameters and everything. It's also worth noting that in the training data set, depending on your algorithm, you will have sometimes to split even more training and validation data set. A validation data set will tell your algorithm, is it going in the right direction and the wrong direction while training. We will not discuss that in details because it will get a bit more mathematical. And in this presentation, we will be trying to avoid all the maths behind AI. Okay. So now we're back to our organization of AI, general organization of AI. We've seen what machine learning does. But there is this deep learning, which is basically neural networks, and it's a bit more interesting. It's the thing that is hyped now, and all the advancement in AI that you are seeing in the recent years. It's all about deep learning, I can tell you. Okay, so what is deep learning? So deep learning is a more complex type of machine learning. To put it in context, early AI or standard machine learning was really into solving problems that were easy for computers because it requires a lot of calculations and a lot of computing. And for humans, it was impossible. But in early AI, intuitive problems like recognizing words, faces, images, problems that are really easy for humans could not be done by early AI because it was really hard to formalize in mathematical structure and functions. So here comes the deep learning, the AI deep learning, which focuses on solving these problems by allowing computer to learn for themselves, learn from experience and data, and understand the worlds in terms of hierarchy, simpler concepts that are mathematically, that can be formalized mathematically, okay? So we're back to our organigram. We talked about general AI, machine learning in general, and deep learning. And in between, there are a lot of methods, mathematical methods, that do not fall neither in deep learning or in machine learning. We call them representation learning, like shallow autoencoders, which is really interesting because deep learning relies heavily on representation learnings. So deep learning is doing essentially representation learning. It's representing problems in terms of by introducing representations that are expressed in terms of other simpler representation. So these layers of learning are what make deep learning called essentially deep, because it has a lot of hidden layers. Okay, so deep learning has a lot of advantages compared to other types of AI. For instance, deep learning can deal with unstructured data. So once trained with the structured data, deep learning models can automatically make sense of unstructured, unorganized data. Also, deep learning can recognize unexpected patterns. So most models requires engineering to select what patterns the machine algorithm will look for and everything. But deep learning algorithm can recognize unexpected patterns without being told so. And sometimes these patterns cannot be even, can be invisible to a human expert. So this is what makes this special. So, and also deep learning has really proven a lot of accurate results, especially with large data pools. In fact, now deep learning algorithms can detect cancer from radiography, especially breast cancer, better than most experts. Okay, so here's what the accuracy parts comes in. So let's come back to general AI. What can AI do? So I will just give some examples here. We have the natural language processing. AI can process language, spoken or written. So it can process it, understand it, and generate a human language, you know, like ChatGPT and a lot of stuff. It's used really in application like chatbots, language translation, sentiment analysis. But in the medical field, it's more of a research function to classify documents, articles, and EHRs. So we can create some structured data from unstructured EHRs from a different organization. Also, AI can do image recognition. It can recognize, classify images, and identify objects of people or other visual elements. Also, it can do speech recognition and reorganize and transcribe speech, converting it into text. Also, it enters in autonomous systems that can control and operate these systems, such as drones, self-driving cars, and stuff like that. AI can do predictive analytics. You will see an example later on. It's like we said in the machine learning example. It's almost, in the medical field, it's almost always prediction cases. It can also give recommendation recommendation systems and expert systems. What recommendation systems are is that AI can provide personalized recommendation based on behavior and the preferences. Recommendation are usually used in application like e-commerce, entertainment, social media, and so on. And there is also natural language generation. In contrast with the natural language processing, natural language generation is more of a generative model. So it will generate text, coherent text, like we see in chatbots and language model based on essentially on transformers and BERT models. And the last thing maybe we can cite is that AI is really good at biometric identification. So it can identify, verify people based on unique biometrics, such fingerprint, iris scanner, facial recognition, and so on. These are just few examples of the many tasks that AI can handle. As AI will continue to advance, we expect a lot more applications. So another thing, the last thing about AI we will be talking about before starting a little bit on the medical pharmaceutical side of things, why AI is having a lot more traction these days. So the simple answer is we have a huge deluge of data in the last few years, which we call a data sphere. There is a lot of data available to us. As you know, AI needs really a lot of data to train. Also, there is much advances in algorithms, in AI algorithms, and computing power. And you should know that really training an AI is resource hungry, very hungry in resource. So we need servers and such things. Another parameter is the democratization of AI tools like Keras and TensorFlow that are making AI programming and the usage of AI a lot more easier. And with these new tools, what brings to the table is that us as let's say non-engineers, non-specialists in computer science, we can take advantage of AI in our fields of work, like medical and pharmaceutical. And as I always say, you do not need to be a mechanic to drive a car. So as a pharmacist, as a doctor, you can be starting using AI without really being an expert in AI, thanks to the advent of these new tools. So for the second part of our talk, we'll be talking about what are the application of AI in the pharmaceutical field. Okay. So artificial intelligence can transform the pharmaceutical industry and improve various aspects of the drug development. Also pharmaceutical research and manufacturing. It can accelerate drug discovery by analyzing large amounts of data and identifying novel targets, designing molecules, and predicting outcomes. Also, in addition to that, for accelerating drug discovery, we have a lot of advancement in what we call omics science. It's proteomic, metabolomic, genomics, and everything that rely heavily on artificial intelligence and computational biology. Also, artificial intelligence can enhance clinical trials by selecting most suitable candidates, reducing error, and optimizing protocols and monitoring outcomes. What AI can do also is to improve manufacturing efficiency by optimizing processes, detecting anomalies, ensuring quality control, and reducing costs. Also, AI can intervene in doing personalized medicine. So it can analyze patient data and recommend personalized treatment. It can monitor adherence and provide feedback. And there is a part of AI which is the task automation. This task automation will empower pharmacists by providing decision support and facilitating communications and expanding their role in the care team. This is only some examples that I could think about, but I'm sure there are a lot more. To be in the practical side of things, we will try to do 2 random examples of use of AI for pharmacists or researcher pharmacists. These are not really hand-picked examples. It's just we have a lot of application for AI, so it was a bit random. It's the first 2 things I could think about. So in the first example, we will try to see how can AI help identify potential biomarkers and or possible drug targets. So in this example, we will see how we could explore simple metabolomic data. Metabolomic is a science of, it's an omic science that studies the metabolome. It's the metabolites. Essentially, it can take a screenshot of the metabolites and an organism using NMR data or something like that. So you have all the concentration of the metabolites in this system, and this data can be processed with the basic AI. So we will use simple metabolomic data with basic AI methods So here we will deal with an example of a mouse model of focal epilepsy. So these mice, we will be injected with cyanic acid. So this acid will lead 4 weeks later to chronic focal epilepsy. So the epileptic zone, which will be called the EZ in this example, is the zone where epileptic seizures start and spread into the brain. It is important to be able to detect and delineate this EZ in the brain and identify what are the metabolites implied in these seizures. So the objective of the study is to investigate whether the NMR data, metabolomic data, collected on mouse brain could allow to detect and qualify the epileptic zone compared to adjacent region. So we will be studying in this example 4 brain regions for these mice. We will be taking the AIH, which is the ipsilateral anterior hippocampus, IPH, ipsilateral posterior hippocampus, and CIH, contralateral anterior hippocampus, and CPH, contralateral posterior hippocampus. These samples will be analyzed in ex vivo using NMR, and 20 metabolites will be quantified in these areas. So, if we do this, we will end up with a huge data set with 20 metabolites with their concentrations. So this data set will be containing hundreds of observations and 20 variables, which are the concentrations, and different regions. So as we said earlier, this will be really difficult to study using statistical methods or taking conclusions and graphical representations. What we can do with AI is to apply a simple principle that is really used in biochemistry and omics, which is called the principal component analysis. So the principal components analysis is a statistical procedure in machine learning that uses some kind of, how to be simple, an orthogonal transformation that converts a set of correlated variables into a set of uncorrelated variables. So what PCA does is basically dimensionality reduction. So we had a lot of data with a lot of variables. The PCA will try to create new variables that are that will enable us to explore the data in a most meaningful way. Okay, so we will have this principal component 1 and 2 that will be our variables, and it will allow us to do a bit of separation and see groups in the studied regions. Okay. So considering the trend of the separation and the example given below by the PCA, we can here we can consider two groups of metabolites that are driving the separation. We see this is how the separation is done. So the two groups will be the taurine, alanine, GABA, and also the acetate, which has a positive correlation here with PC1. And the PC1 is explaining like about 38% of the variation. And also we have negative correlation from PC1 and 2 with glycine and glutamate. So we should focus on these metabolites and study if there are really the metabolites driving the separation between the groups, and if they may be candidates for drug targets or biomarkers. Okay, and what we can do more is to do a classification technique. It's a supervised modeling technique, like we saw earlier, which is called the PLSDA. PLSDA stands for partial least square discriminant analysis. And it's a classification technique that uses the linear regression, if you remember your linear algebra, to maximize data separation. In simple terms, it essentially rotates the PCI axis, these PCI axes, rotates them in multi-dimensional space, so we can augment the covariance, and we have really better separation of our study groups. And here we took only one region, is the HIA, compared to all the other regions. It was just a choice in this research, and it yielded good results. So to identify the most important markers, we can, after validation of the robustness of this PLS, rely on VIP plot here, which is generated by AI according to the known data. And we will be taken, for example, the most important ones, which has a VIP score over 1.2. So it will be in our case the GABA, the acetyl, the alanine, the phosphoethanol, and the N-acetyl aspartate, and we may be considering the glutamate. So without a lot of effort, we were able to identify some biomarkers relevant to our situation, and these biomarkers can be even studied in drug targeting. So I hope for this example it was a bit clear. I wanted to give you a little dive on how things are done without being too technical. Now we can move on to a second simpler example, which is the use of digital twins for biological experimentation and also for personalized medicine and precision public health. So a digital twin. What is a digital twin? A digital twin is a concept. It's derived from industry sector. It's a virtual entity that recreates a real entity in a digital way. So it uses historical data, real-time data, and algorithm models to simulate, verify, predict, and control an entire life cycle or an entire real entity. So it can be from a subcellular level, like a mitochondria, to an organoid or even a whole organism and a whole population. So we have two types of digital twins. We have mechanistic digital twins. These models are created with extensive knowledge of the mechanisms driving our system. So if you are taking, let's say, a cell, your biochemical knowledge of the cell, chemical knowledge, biochemical and physics, and all the data you have on the cell and how things work can help you create a mechanistic model. This model is the most explainable model and is really used in biomedical research. So, and also we have another type of model is the mathematical statistical digital twin. It's a digital twin creating without really taking into account how things work. You just have the input, the measures of inputs, and the measures of outputs, and you can use artificial intelligence and statistical methods to, let's say, map your system as a really huge, complex mathematical formula that will yield always the same result as your real system. So, in the biomedical experimental biology fields, these DT can vary in scales and can have different uses like exploration and observation, forecasting of results, simulations. And there is an advantage that personally I think is really important, that it can reduce animal experimentation And the digital twins may be a good candidates for what we call the 3R model. The 3R model is it's an animal research model, which is the 3R stands for refine, replace, and replace, reduce, and refine. Yes. So we can replace our animal models, and we can reduce the use of these models. And we can alleviate, refinement is to alleviate and minimize the potential pain or suffering for these animals. So you are all students of pharmacy. I believe you did your practicals in pharmacokinetics, pharmacodynamics, and biochemistry, and you had your fair share of lab rat skills. Imagine a huge industry, how many lab rats they can kill yearly. And I tell you, it's a huge number. So what if I told you that AI could save your little furry research assistant by reducing the number of lab rats used by basically simulating them? You are creating a digital twin of your rat. So you could reduce the cost of the animal experimentation. So it's cool and stuff, but digital twins have really a lot of problems, like misinterpretation of the data, and also they are really prone to biases. The fact is, bias is also introduced in the initial data sets. There is a concept called the GIGO, which is garbage in, garbage out. So if you have bad quality data in the input, you will always have bad quality data on the output. So I don't know if you are in time or not. Maybe I took a lot of time. So I will try to go a bit faster. We are almost finished. What digital twins can do is to improve personalized treatment. It can help do a faster drug development and shorten the research cycles. It can do better predictive maintenance in the pharmaceutical industry. It can enhance supply and chain management also in pharmaceutical distribution and manufacturing. So it can have a lot of advantages. As we thought earlier, artificial intelligence has really many challenges in its implementation and use in the pharmaceutical and medical field. The first challenge is the data deluge. The data deluge is the data available to us. So we have really a lot of medical data and a lot of data in general. We see the evolution of data. Taken an example, the data sphere or the digital universe in 2005 was about 0.2 zettabytes, and zettabytes is like 10 power 21 bytes. And in 2022, it's about 44 zettabytes and expected to be 175 zettabytes in 2025. This is really a huge amount of data. And the huge amount of data is maybe considered as a challenge, but also for medical studies as an opportunity, because generally the main problem of artificial intelligence is the scarcity of data and the availability of data, because it's generally more sensitive data, which is subjected to privacy and everything. So the second challenge that may be facing AI now and in the future is the four V's of big data. The four V's of big data is the data volume, we talked about it, the data variety, especially in the medical field, the source of data are really different. So you have written data, audio data, imaging data, medical imaging data, machine data, and all these types of data are not really easy to deal with in your artificial intelligence models. So it's not unified. It's really, really a challenge. Also, the velocity of data. You have new data every day. So your models would be able, preferably, to be up to date, to be concurrent with the new data. Also, we have the veracity of the data. The veracity is more about the quality of the data. And as I said, there is this GIGO concept. If you have a bad quality in your input, you will always have bad predictions on your output. Okay. And also, there's something really really specific to the medical field in AI is the AI explainability. As we are dealing with lives of patients, with outcomes, with prognosis, with the really sensitive data, all your findings should be explainable, and which is really not straightforward with AI, because sometimes it's a black box. You have information in, and you have information out, prediction out, and you don't know what's really happening inside, especially for neural networks and really complex systems that the reasoning behind them may be too complex for simple human understanding. So we are opting more to something in medical like manifold learning, causal inference, and mechanistic models, like we said, that are more explainable. And the last thing we will be talking about is the legal implementation of the AI in the medical field. So there are really a lot of challenges, like the legal implementation and the privacy, the ethics, and the ownership of the data, because it's medical data and it's really sensitive. Also, we have to think about also giving a proof of the added value of implementing machine learning techniques instead of traditional techniques. And we won't go into details. We have a lot of technical limitations and infrastructure limitations. So to conclude, there are a lot of challenges, a lot of things to outcome. But every day we are doing a step forward to more implementation of AI in the pharmaceutical and the health field. So I hope I did not take too much time. Yes, I did. So as we saw, we had some brief concepts of AI, and we took two examples to see how things work in a simplified manner. And I hope you could take, let's say, take a home message with some information, and you have now a bit of idea how AI can be used in simple terms. Okay, and thank you for your attention.
Thank you so much, Dr. Sioud, for this enriching session. Now we'll be following to the Q&A. But we also would like to invite Dr. Sioud's colleagues, if there's someone here with us today. So if the floor is yours.
Also, like from the audience, if you guys have any questions, you can write them at the chat below. We will go along with some questions from our registration forms while you type your questions. One of the first questions from the pre-written ones is, what are some limitations using artificial intelligence to support decision making? Like it's a more specific area in pharmacy practice. Will it affect the decision making process of our practice?
Yes, this is really an important question. I believe the first thing that we should consider is the legal responsibility. So if a machine learning program affects your decision as a pharmacist, are you responsible, or is the engineer designing this artificial intelligence responsible for your decision? So that's a legal aspect. And also, you should know that artificial intelligence are prone to errors that we humans cannot expect. So you can see in the trending ChatGPT example, there is something that we call AI hallucination. So AI can really convince you of something that is really, really, really wrong, and put as a fact with proofs and everything, because AI for decision making and also for model languages based on transformer models do not really understand what it is doing. For the AI, it's just a mathematical equation, and it's applying some weights and mathematical concepts to sometimes really simple intuitive problems, but the AI is not able to grasp the full context. So it may cause a little bit of problem and false information, but also the main problem trending now is the legal responsibility.
Thank you for your answer. We're going to go with the question in the chat box. As a pharmacy student interested in the combination of AI and health, what practical starting steps would you suggest? Any resources would you suggest?
Okay, as a pharmacist practitioner, I believe, well, before we talk about that, I would like to say something about any new technology when it is implemented, especially in the pharmaceutical medical field. We are a bit of rusty people. We do not evolve rapidly. So AI is always introduced in either the industrial side of things or in the research side of things. And when it is proven and democratized, it will be accepted in the daily practice. So I believe now we are in the early stages of implementing AI in the pharmaceutical fields, and it's a bit limited to industries and research. But I believe there is a new European initiative. I had to work with the HIS in France, and also I have a contact in the Health AI initiative of the Netherlands. They are trying to create a framework for implementing artificial intelligence in the medical and pharmaceutical fields in Europe. And this framework will be the tool to, let's say, implement AI in our daily practice, apart from what I said, industries and research.
Thank you for your answer. There's also a similar question, like what are the prerequisites, background, and training that can help them in this transition from as a pharmacist from this regular pharmacy practice into the AI and digital health?
Okay, so this is really interesting question, because it will depend on what you want to do. So as I said, you do not need to be a mechanic to drive a car. So as a pharmacist, you will be able to easily start doing artificial intelligence with some basic notions and some basic knowledge of programming, like Python and R languages or something like that. And just also some basic statistics. You can start doing, let's say, taking advantage of artificial intelligence in your line of work, your daily work, without really being an expert. Myself, I am no expert. So compared to AI researchers, to hardcore AI engineers, it's a lot more mathematical. It's really complex. But us as medical professionals, as pharmacists, we can start taking advantage of AI without being really experts in the making of the AI. And gradually, we will start putting our input, our logic, our understanding of the medical field to use.
Thank you so much for your answer, for your incredible presentation. I truly enjoyed, especially the examples part, really made sense with all the context. So I really thank you. It was a very fruitful session.
Thank you. It's an honor for me.
So without further ado, we would like to yield the floor to Mrs. Maria Halimeh to continue with her presentation.
Hello, everyone. Thank you so much, Is, and thank you, Philippe, for the kind invitation. It's a pleasure to be here with you all today. Let me share my screen. Okay. Okay, so my name is Maria, and I'm serving as the chairperson of pharmacy education for this mandate in IPSF. And I'm also a Chief Metaverse Officer at the International Social Prescribing Pharmacists Association. And in today's presentation, we'll be going to talk about the future of pharmacy innovation, glimpse into meta pharmacy applications. So with technology evolvement, innovation, and evolvement of many recent advances in technologies, we can see that the Internet Web3 networks are going far beyond our expectations, and they are actually going far beyond connecting people. So you have probably heard a lot about the world metaverse in many social media platforms, in LinkedIn, and many other applications. And also a lot of applications are decided to change their software to include Meta in this updated version. So what is metaverse? Like, what is simply metaverse how can it be defined in a simple words? Well, metaverse is a network of linked virtual worlds that are overlapping with physical realities, and they are facilitating an immersive experience to meet and interact without any geographical boundaries. So you can imagine that you can, by simply putting your headset, you are experiencing a real virtual experience while you are sitting at your chair in your home. So where does the word metaverse come from? Well, actually, the word metaverse is a combination of two words, meta and universe. Meta refers to experiences that transcend physical setting. So meta is related to the experiences that are intersected with the physical world. And universe refers to the emerging virtual economy that creates a real world value. So by combining meta with universe, we can come up with the word metaverse, which simply refers to getting an experience in the virtual world, but it does have an impact on your real world. So that's why the metaverse is making a broad shift in how we interact with technology, and throughout the conversion of several technologies such as physical, virtual, augmented, or even mixed realities technologies. So let's take an example before coming up with this slide. Imagine that there is a patient, and this patient is having paralysis, and the same patient is also taking Alzheimer drug medications. So imagine how bad this patient feels every day. He cannot go outdoors, he cannot experience any life activity, and he cannot even live the normal life that people live and enjoy. So the metaverse here actually plays a key role in improving the patient's well-being. So imagine that he can be going into a hiking trip or in swimming trip or snorkeling via using the VR technology. This will eventually improve his well-being and his satisfaction. So the metaverse doesn't only eliminate the physical boundaries between people, but it also seeks to extend social interactions to a virtual setting. So with only one click in a personal virtual reality VR or the augmented reality headset, the patients can simulate, or the user can simulate the physical world in the virtual atmosphere and enjoy an immersive experience of virtually interacting with people and with the experience itself. So this has not only influenced people's social lives, but also every aspect of human beings, including healthcare, pharmacy, and medicine. And the upcoming slide, we'll be talking about how this can be relevant to pharmacy. So you may ask yourself now, okay, Maria, that's good and that's great to know, but how this can be evolving in pharmacy profession or in even a health profession? So recently, pharmacy practice has evolved from simply dispensing drugs and over-counter medicine to a more service-based model, where pharmacists play a key role in managing drugs and diseases. So there are a lot of currently emerging digital health trends that are evolving to improve patient satisfaction, and they are actually going deeper into taking preventive medicine approach. So there are a lot of digital health applications, as you can see in the two slides, that are applied in the medical healthcare settings, such as mobile health technologies, mobile health applications, personalized medicine, telemedicine, electronic medical records, telehealth, wearable devices. And all of these technologies, all of these applications can be set in as one databases that includes all of these technologies, and it is serving as the place to find digital health and medicine solutions, including applications, devices, services, and even resources. Now we have just introduced the metaverse and its interrelation to the healthcare field and how digital health is evolving. So now we are ready to take practical examples on the meta pharmacy applications and how this can be evolving in the pharmacy profession. So the first example or the first application is this application, which is called NANOM, which is a drug discovery application. So in this application, the user or the healthcare provider, part of the healthcare team, can be using this application to discover new lead compounds and new leads of the biochemical drugs. It doesn't only allow the use of these drugs, but also it allows testing, chemical testing and molecular modeling of different protein structured compounds to know how they can be interacting with each other. So they are considered as the most effective. It is considered as the most effective tool for drug design decision making, as they integrate several tools and workflows and team members over the world to design and interpret these reactions. So what distinguishes this application among the traditional computer-based models is that this application is serving and providing the efficiency of showing a 3D view of molecular compounds, which is something that is not allowed in the computer setting. And by the combination of human creativity and the global collaboration, and of course, distinguishing and designing the active ingredients, all of these, all in all, will be eventually helping the healthcare team and especially pharmacists discover new leads of compounds in an easier way and accelerate the drug discovery process faster than the computational drug design approach that is conducted usually by the computer-based models. The second application is based on the concept of the immersive environments. So first, before talking about this company, what is immersive environments? Immersive environments are virtual or hybrid environments where pharmacist or healthcare team and the customer or consumer can interact together in just one space. So when we say we have immersive therapeutics, we mean that we have specific medications that are delivered to the patient via VR platform or VR therapy. And these medications should be accessed by the healthcare team. So one of these examples is called the Applied VR, which is a company that provides several products to help patients improve their well-being via controlling their pain level. So they are usually used for patients who are experiencing chronic pain in several settings. So one of the products that this company applies is called Relieve VRX, which is a virtual reality immersive VR that is used for patients who are experiencing chronic lower back pain. And this therapy allows patients to feel less painful with regards to the medication that they are taking. So it is considered as an adjunctive treatment to their medication, and it allows the patient to feel better in a way that he doesn't get affected by the painful feeling on the side effect that the chronic lower back pain medications might deliver. And there are many studies that are conducted for the Relieve VRX, and it is considered the first authorized FDA immersive virtual reality treatment that is applied in the world. And another example of the immersive environments is XR Health. And XR Health is simply virtual clinics. So patients, pharmacists, doctors can join these clinics in a meta space where they can also interact with each other at any time using FDA-registered medical applications. So it allows both the pharmacist and the patients to experience a metaverse communication and a consultation room where they have the accessibility to discuss several problems and practice patient counseling, improve their well-being, and of course lead to better approaches in biopsychological social health. So this is also one of the applications to the immersive environments that is currently existing in the real world. So now talking about this application, before digging into this example, as this application is based on the concept of the digital twins. So as previously illustrated by the doctor, the digital twins resemble real-world entities, but they exist in the virtual world. So the digital twins can be serving as, allowing virtual patients to register in kind of applications, and virtual patients can interact or respond to specific stimulus or specific interventions that the pharmacist or the healthcare provider intervene to the patients. So one of the examples to the digital twins is called Virtunomy. So in this application, there is a databases that include virtual patients with virtual organs such as the cardiac muscle, the lung, and so on. And also it includes animal models, virtual animal models, where the medical healthcare team can perform several chemical testing or even current medications to experience and show how the organ can respond to this medication. So it kind of have a simulation to the virtual lab, to the existing lab, but in a virtual experiment. So also this is helpful a lot in accelerating drug development process, because this means that these experiments can replace the clinical trials that are occurring in the drug development process. So it will eventually lead to widening the scope of the experiments, and at the same time reducing the high cost that might be the main issue of many clinical trials. So with this application or with this concept, a lot of problems can be solved, and a lot of compounds can also be tested without putting patients at the danger of the clinical trials, especially when the drugs and the chemicals are dangerous and new. This is another application for the digital twins, which is called Baywilin, which is also a very easy and friendly to use application where patients can use at their homes, and they can register to the application, insert their information, their health condition, their heart rate, their body mass index, and everything related to the everyday health. And pharmacists and the doctors can have daily access to this application, and so they can connect with the patient at any time during the day. So it is easily accessed 24 hours for patients, and pharmacists can advise the patient on how to manage his diet, how to manage a specific side effect of a drug, and everything related to the patient's risk as well. So moving forward, the virtual reality and metaverse applications in pharmacy are not only focusing on the drug discovery, development, and community pharmacy, but also they are going to another approach where, if we can give a brief example or similar examples to the medicinal plants, when we say that some medicinal plants are used as counter irritants to specific medication. So in the same concept, VR can be used to distract patients from a real pain that they are experiencing due to chemotherapy or surgery or a very difficult health condition. So VR is also used to do that, and is also used to make these patients experiencing less feeling of pain due to these difficult surgeries. And since there are a lot of applications of the of the metaverse in pharmacy and healthcare, this application or website, which is called VR for Health, allows learning about wellness and therapeutic VR. And it is considered as a unique platform to learn about wellness and therapeutic virtual realities. And also it connects you with virtual reality solutions companies, so that you can learn more about their products and how you can, in the future, have a view on how you can use a specific application to serve the health of the patient. So this is also another example, which is called VR Pharma, which also resembles the same concept of the virtual consultation rooms, but it is used for both, for patients and for the pharmacist. So it allows the pharmacist to, the healthcare staff to be ready to use the system and to be equipped well to use the library and have necessary training for treating the patients. And in just a little amount of time, in short notice, in less than 20 seconds, the healthcare staff team can serve the patient and put them under amazing virtual experiences. So it eventually leads to improving patient care and improving the satisfaction of the patients and the quality of healthcare as well. So as any technology in the world, as anything in the world, it does have limitations. So what kind of limitations that might arise due to metaverse applications in pharmacy? Well, there are a lot. We do have low sample sizes. We don't have enough research conducted in these terms. We still need more data to be conducted on the metaverse and on the side effects that might be helpful to know how this medication, to what extent these medications can be safe to patients. And besides that, the accessibility of the virtual reality technologies to patients is still a question where we don't know yet how we can deliver these medication or applications to poor countries or to people who don't have access to technology in this time. So we still have the accessibility concept put into our mind, so that we can think about how we can improve the infrastructure of the meta environments in order to make it less expensive and more easy to use for people from all around the world. Besides that, one of the problems that might arise during drug discovery and development when we use avatars or digital twins, some avatars might overlap with each other, simply to making a mistake, and then this mistake can be resulting in reducing the efficacy and effectiveness of the medication. At the same time, these applications still need to be conducted in wider scope of people in order to know how to best manage their applicability to patients. There is also another issue that is arising due to the technology involvement, which is the decentralization concept. So since all of these technologies are present in one space and decentralized space, data are put into decentralized platforms where the privacy of the patients or the customer is also put into a question. How we can improve the privacy and the safety of the data from going in places where it should not be going. So we need to still focus on how we can make these data more efficient, more effective, more private and safe to patients. We need to conduct more research areas on these fields in order to know to how much extent we can improve them in a way that can be manageable and applicable at the same time. So this is the last slide in this presentation, and I want you to imagine with me like how a meta pharmacy can be built in meta space. So imagine that there is a patient who is experiencing diabetes or having diabetes, and this patient is usually taking insulin therapy. To some extent, at some point, the patient got an injury and he cannot move out to the pharmacy or to the doctor. So the patient is locked at his home. He cannot access any healthcare team and he is alone at home. So what solution he can be provided with in order to help him manage his situation? So meta pharmacy comes in hands to help this patient. When patients join a meta pharmacy as an avatar with the pharmacist in a virtual consultation room, the pharmacist and the doctor and also the patient can interact with each other via resembling these avatars. So the patient will be feeling safe and also will not be embarrassed to show or experience or express any medical health condition. At the same time, the pharmacist can advise and show the patient how he can address his insulin therapy to the right location. And he can also collaborate with the doctor to prescribe a digital prescription and send it to the patient at his home, where the patient can order in a very safe and fast way. So with the virtual pharmacy, pharmacists also can practice patient counseling to this patient and advise him on how to eat well and show him examples of several side effects of the drugs, and let the pharmacist feel that let the patient feels that he is in a real pharmacy, and eventually it will be improving the patient well-being and accessibility of healthcare. So at the end of the day, the main aim of technology is to connect people. So technology is best when it brings people together. That's the main aim of the main aim of integrating technologies in healthcare team and in pharmacy, to improve the well-being of the patients and improve the connection among people. Thank you so much for listening, and I hope that it was fruitful, brief session, and I'm open to any questions.
It was a wonderful presentation. Thank you, Ms. Halimeh. It was really eye-opening with the examples. It was truly an area that we have not heard before. So for the audience, you guys can write up your questions at the chat box. While we wait for people to write, I have some pre-written questions for you. First off, I'd like to start with how might these changes can change the approach to patient care, and like how long will this type of new idea of pharmacists will be in common practice?
Okay, thank you so much, Liz. Thank you so much for the question. So it will lead to proper healthcare, as it will improve the accessibility to healthcare services, and to many to experts, it means they always advise that it might take around 5 years to see that these technologies are really integrating in healthcare team. So it might take 5 to 10 years to see how they can have this impact on the healthcare approaches.
Thank you so much. We'll go with the second question. How can pharmacists stay up to date with the latest developments in pharmacy innovation and incorporate these into their practice, as you also did? Like, what would be your first advice?
Okay, thank you so much for the question. So my advice is that reading is the key role. Reading about these technologies and getting updated every day about what is the current trends of the innovative technologies every day is the key concept on being aware of what is going around the world. So reading, attending conferences, participating in several virtual events, collaborating with other staff or other communities. It doesn't have to be with the pharmacist. It's just can be with the computer scientist, or events that are for people who are out of our fields, because eventually we will be collaborating with them to make a proper impact in the world. So collaboration is the key point in making an impact in pharmacy. We don't need to be equipped with these skills, and we don't need to be a professional in how to use these technologies, but we need to know how to apply them in our fields. And this shall start with knowing how to collaborate and educating ourselves every day by day.
We have a question from the chat box. Can you please detail how these technologies may be implemented in a current healthcare scene from an organizational or legal point of view?
So thank you so much for the question. So currently, there are some applications that organizations that are applying these technologies in a simpler way, so that they can be applicable to patients from their mobile phones. So for example, there is an application that is called Mozilla Hubs, which also provides the opportunity to practice one-to-one communication via avatars with patients or with customers via a 2D setting. So nowadays, some companies are using these 2D approaches to simulate virtual reality concepts in a cheaper way, in a simpler way, via using these as rooms and interacting with each other via avatars, where these avatars resemble the patients or the people, and they can also build several rooms for several types of services, such as for pharmacy, for medication management, for a drugstore, and so on. So there are still questions about how they can apply this into real-world entities, but the most recent approach, or the most easiest way, is to use the 2D applications to resemble the virtual experience. But I guess we will be seeing this progress getting faster in the upcoming 5 years, where we will be seeing that the virtual rooms can be existing in the virtual 3D approach.
Thank you so much. I actually have another question. What would be the regulatory bodies for these applications? Like how these apps can be regulated?
These applications shall be built by collaboration between regulatory authorities, business startups, and a medical staff team. So some applications can be built by collaboration between medical staff team and also the business leaders of business startups to know how to design these into projects that are customized to the patients. So this is one way of collaboration, of the conduction, and another way is to might be conducted by regulatory authorities, where they can reach out to the community pharmacists or the pharmacists in general and collaborate with them on how to use the resources that they have to build these entities.
Thank you so much again for your answers and for your presentation. It was truly a very eye-opening session. I really enjoyed it, and I hope the audience also did. Right now, I'd like to yield the floor to Philip to close the session.
Thank you so much, Ece, and thank you to our amazing speakers. So thank you to Ms. Halimeh and thank you to Dr. Sioud for presenting today. This brings us all to the end of our session, so the end of the webinars for the future of pharmacy, and thank you all to all the participants for joining. Before we end off, I would please invite you all to open up your camera so we can take a group photo at the end. So please do that.